Respiratory tract infection, upper and lower respiratory tract infection. Normal flora of pharynx include number 1. Streptococcus viridans, type alpha hemolytic, and Streptococcus pneumoniae. Number 2. Non-pathogenic Neisseria species. Number 3. Moraxilla catarrhalis. That this can also be respiratory pathogen. Number 4. Staphylococcus include Staphylococcus aureus and Staphylococcus epidermidis. Number 5. Diphtheroid, with exception of Corynebacterium diphtheria. Also Haemophilus influenza. Yeast include Candida species, but in limited quantity. The throat of elderly immunodeficiency patient when they have received antibiotic may be colonized by Enterobacteriaceae special, Escherichia coli, Klebsiella, Acinetobacter, according to Pseudomonas. Streptococcus pyogenes, the most frequent cause of bacterial pharyngitis and tonsillitis. This infection prevalent in young children from 5 to 12 years. The most pathogen for upper and lower respiratory infection include Corynebacterium diphtheria, Bordetella pertussis, Streptococcus pyogenes, Streptococcus pneumoniae, Mycobacterium tuberculosis, Neisseria meningitis, according to yeast such as Candida. Corynebacterium diphtheria is the cause of diphtheria. Corynebacterium diphtheria cause a typical form of infection characterized by grayish white membrane at the site of infection, pharynx, tonsil, nose, and larynx. Diphtheria diagnosis is made on basis of clinical finding. Culture for Corynebacterium diphtheria. Although the diphtheria bacilli grow well on ordinary blood agar, grow is improved by inoculating 1 or 2 special media. Number 1. Loeffler coagulate serum or Dorset egg media. Number 2. Selective tolerite blood agar that stained by Albert Stain. Albert Stain, special stain for Corynebacterium diphtheria. Explain the Chinese letter form, special form of Corynebacterium diphtheria. Gonococcal pharyngitis has been recognized with increasing frequency in some countries, with the incidence of cervical and urethral gonorrhea. Culture of throat swab for gonococci should be done by using selective media. The selective media for isolation, Neisseria gonorrhea, modified Thayer-Martin media. This is special media for Neisseria meningitis and Neisseria gonorrhea. Collection and dispatch of specimen. Specimens should be collected by specialized or other trained personnel. A sterile cotton swab is rubbed over each tonsil, over the back wall of the pharynx, and over any other inflamed area. 2 swab placed into container and sent to lab. If a specimen cannot be processed within 4 hours, the swab should be placed in transport media, EMS and saturated media. Direct microscope. Candida is the best recognized on gram stain smear. The gram stain smear is not useful for detection of streptococci or Neisseria species and poor sensitive for detection of the same bacteria such as diphtheria. Culture and identification. According to Streptococcus pyogenes, the swab should be cultured on blood or chocolate agar and incubated for 24 hours. But laboratory diagnosis of Streptococcus pneumoniae specimens include sputum, blood, pus, cerebrospinal fluid. The first step, gram stain explain gram-positive diplococci, capsular swelling test, quelling reaction, and number 3 culture on blood or chocolate agar according to antigenic detection by specific anti-sera. Lower respiratory tract infection, the most common infection, acute and chronic bronchitis. Pathogens include Haemophilus influenza, Streptococcus pneumonia, or less often Moraxella catarrhalis are found in sputum. Lung abscess and an abscess may form in lung following the inhalation of foreign body. Pneumonia and bronchopneumonia. Infection is caused by Streptococcus pneumonia. Klebsiella pneumonia occasionally occur in epidemic form. Pulmonary tuberculosis. The sputum of patient with pulmonary tuberculosis is usually not highly virulent. An acid-fast stain smear, Zell-Nielsen, should be examined microscopically to detect immediately organism as possible and to leave the tuberculosis bacilli viable and thus suitable for culture on Lowenstein-Jensen media. Lowenstein-Jensen media, special media for culture Mycobacterium tuberculosis because this fastidious bacteria. Culture procedure include sputum or other purulent material using sterile swab or loop and inoculated on different culture media from which blood agar, chocolate agar with citric of Staph aureus to facilitate sterilized growth, Haemophilus influenza with optogene displays on metal, according to McConkie agar. This media include incubated in aerobic condition for 24 hours and then work biochemical test for final diagnosis. Laboratory diagnosis of tuberculosis bacilli include microscopic examination of acid-fast bacilli in sputum and stand with Zell-Nielsen stain, bacteriological culture of a specimen on a special media named Lowenstein-Jensen media and agar egg-based media, Harold media, and non-egg media, Middlebrook media. This three type of media that culture on which Mycobacterium tuberculosis according to incubated in 37 CLZ for 24 hours.